accessibility and community partnerships and engagement for NHS South West London. So we're the funders for this grant programme. As Sarah has said, she's recording today so that we can share this with other people that might be interested. But if everyone wouldn't mind just introducing themselves in the chat, your name and organisation, just so that we know who we've got with us today, that would be absolutely brilliant. And if you want to ask a question, there's a hand function on Zoom. Hopefully lots of us are all know to use Zoom now, but you can just find it at the bottom and put your hand up, or you can ask a question in the chat and then we'll come to you at the end. There'll be plenty of time for questions at the end. So this year, for those of you who aren't aware about this grant programme, we've been running our Winter Engagement Fund from the NHS in South West London for 2 years. So this is our 3rd year. And this grant programme offers up to £500 to fund community and voluntary sector organisations to sort of run and build on local activities and events they have to help us speak and listen to local people. And the aim of the kind of grant is really to support people to stay healthy during the winter period. So that can include topics such as the NHS app, supporting people with information about vaccines, finding places to support, using local pharmacies to really support people during the winter period. And this year we've got a real focus about collecting feedback from what we hear from local people in these events. So it's on our application, it's on our website, and that's the kind of page that you'll see where you'll find all the details of the application form. And I'll put the link in the chat in a second, but we will circulate the slides. So there's a link at the bottom for you to be able to kind of find out more, and there's some guidance there. So this year we are working with our South West London Voluntary Community and Social Enterprise Alliance. Some of you might know Zara on the call, so she's the director for that kind of partnership work across the 6 boroughs in South West London. And through that, Croydon Voluntary Action are managing the application phase. But this year, the kind of process of distributing the grants will be from a local community and voluntary sector organisation. So it will be an organisation in one of our 6 boroughs. So that's slightly different this year. So what are we looking to fund? We're really keen this year to hear from organisations that can reach and engage with parents and carers with children aged 2 to 3, people who are pregnant, people aged over 65 years old, people who may kind of have barriers in accessing their health and care or issues accessing specific services. So communities that are furthest away, say, from our local NHS services. We're also really keen to engage with people living in specific areas in our 6 boroughs. So Croydon, Merton, Wandsworth, Sutton, Kingston and Richmond. And in the application form kind of details much more smaller areas and kind of ward level areas in there. And also that for organisations who can set up activities and events that help that you know are a event or an activity that enable you to speak and listen to people, but also kind of building on activities that you might already be running and sort of kind of bolstering them and kind of building on them and making them a bit bigger with this fund. So I've put there the different questions that relates to on the application form. And the reason we ask in these questions is we do base our funding decisions on the information that you provide in all of the application form, but specifically this is a key area. So it's really about you as an organisation, who can you reach and who can you engage with. So it's really important to answer these questions as accurately and as fully as possible, please. So what's new for 24-25? So those of you that have maybe been funded or applied before, we just wanted to outline a few new things that we're doing this year. So we're really aiming to build on our learning and our approach from previous years. And just to say, take this opportunity to say a massive thank you to all organisations that have been involved last year or the year before. It really is such a great programme with such great reach, and kind of funding organisations across 6 boroughs is just really is amazing and fantastic. So this year, we are also offering an additional £50 to organisations to be able to download and print their own materials and leaflets for their events and activities. So we heard loud and clear that sometimes there's some issues with that, and actually some organisations want to take that and do that themselves. So we're offering £50 on top of the 500 if you want it, to be able to sort of do that yourself and print that yourself, or organise that printing yourself, and we will provide you with those materials that you'll be able to sort of download and print. We always have done translations, but this year, based on our local knowledge, our local data, so census data, and who we know that you know, what we know about the communities that live in our areas, we're offering translations in up to 13 different languages as a standard. So you'll be able to pick them if that's kind of meets the need of your activity or the communities that you're going to be speaking to as part of this fund. So just pick that in the application form. We're also going to strengthen our training offer this year to help you speak to your local communities and also collect their feedback and experiences, and sort of tools to be able to do that. So really about how you can really make the most of your event and activity when it's happening, and making that as easy as possible for you. We have been working with our previously funded organisations to really get that process you know, as supportive as possible for you. And as with every year, we will also provide like an information pack, which will kind of be your go-to guide for any kind of questions that you have or anything that you need to know. So if you have said you're going to print your own materials, there'll be a how-to sort of guide to do that and where you would find those materials, that kind of information around how to support you to have good conversations at your events and speak and listen to people, and how you collect that into your evaluation form. That will all be detailed in one place, in one kind of pack for you to have and kind of support you through the activities. We'll also be asking all of our funded organisations to join our local community voice forums in the relevant boroughs that make sense to where you are based, or your reach and your communities if in each of our 6 boroughs. And over to you, Hilary.
Hi everyone, so I'm Hilary and I've been working with Croydon Voluntary Action to help the NHS team to distribute these different community funds that they have. As you've heard, there's going to be more local involvement at certain stages in this process, but for the first stage, a point of contact for you if you need any help with anything. So just to kind of go through some of the things you'll find in the application form, standard information about who you are, where you're working, and making sure we can get in contact with you. So the fund is open for community and voluntary organisations. That's small community groups. You will need to have some kind of committee, a bank account in your own name, etc., that you can that we can put the fund into. Registered charities, CICs. If you're not sure, do get in touch with me if you don't think you fit into that category, or perhaps it's looking to build some connections with other organisations in your community. So I'm reiterating a bit of what Kate has already said in terms of what you need to show in your application. But this first part about information about the work of your organisation, so that's really important, because what we're looking for is people that have those connections. This fund is only £500. So this is really about bolstering, making bigger and better the things you're already doing. I think that's where this fund fits best. So tell us what you're already up to, and then you can begin to describe, well, if we had an extra £500, this is what we could do, and this is how we can help meet the needs of the NHS fund. So in which case, you know, how will you organise your time? So thinking about your current events and activities, a simple one that we often refer to is, you know, if you're running a yoga session for the community, lovely, where will you then be able to fit in this opportunity to stop and talk about some of these health issues, get those conversations going, and giving yourself time to take notes and keep a record of what you want to feedback as part of your evaluation. So just thinking about how you'll be planning those events. You'll need to talk about your proposed dates and times. Now, these can be confirmed later on, but just to give us an idea of when you feel that this would fit in to your schedule. So we're asking organisations to start thinking about delivering this mid-November and then having it finished by January. Some organisations will run lots of little events, and that fits well with them. Others have gone, right, we'll spend the £500 on one big event and we'll get lots of people in. However you think it will work best for you, that's fine. Just, it's one of the nice things is the range of different types of activities that we have. Talking about numbers of people that might come or numbers of events, it's not about large numbers necessarily. It really can be about the quality of time you're going to have with different parts of the community. You know who you're working with. Sometimes small groups is the best way to go. Sometimes a big family celebration is the way to go. Just, again, up to you to decide. Just be clear with us about what you're expecting to be able to do and what you're expecting to be able to do with this budget. So this, as I say, is about really helping you to extend your session, draw more people in, perhaps giving people a nice treat. We are talking about over the Christmas period where, it really can be quite dark and dismal and a bit of struggle for people. So perhaps this can be something that is fun for people to come to and, gives them a chance just to share how things are. I would say it's very unlikely that you would need to pay for any sort of guest speaker. We can connect you with NHS teams. If you would like some NHS expertise to come to your event, you can tell us that in the application and we'll link you up. So I'm not expecting to see people saying we'll pay for an external speaker to come and speak. However, something maybe like a bouncy castle, that sounds like a lot more fun, so, thinking about how you're going to use that £500. You'll see at the bottom there, it's talking about documentation. So adult and children's safeguarding policies, what's relevant to your organisation, DBS checks for those running the sessions, having some public liability insurance. We need to know that your organisation has that structure around it. It's unlikely, you don't need to attach those to the application. It's unlikely that we'll have to check, but we may have to check. So just be aware that that's what we're expecting from you. The same if you are a very small community organisation, not a registered charity, I might need to ask you for your constitution. So just be aware that we might need that paperwork from you. Okay, next slide then. Okay, thank you. Okay, making the actual applications. So applications are open now. I'm thinking this is going to be quite popular. It's a nice, simple application. It's boosting what you're already doing. You can imagine we are expecting quite a lot of applications. So I will just say it's a great fund that has been able to have a good wide spread across the 6 boroughs, but there is a limit to the money that is there. So just be aware. Obviously, we'd love to fund everybody, but there will be some people, I think, looking at the numbers of applications that are coming in, there may be some people that are thinking, hold on, I can do this. Yes, we can see you can do it, but you might just not be hitting the particular areas, the particular communities quite as well as some of the other applications. So that's the challenge with this one. We spread the money as thin as we can, but just be aware it is a popular one. Please, so you can download the application form in Word, which can be really helpful for your planning and your discussions and putting together your plan, but please complete the application online. Obviously, if you have a problem, come back to me with that. But if you complete it online, that means it gets processed correctly. And there's guidance on the website there as well about just saying again about what Kate is looking for and what the NHS teams feel that they can really get when they're supporting these community activities. anything that you need to discuss with me, there's my email address is training@cva.org.uk. I am rather part-time, but I do come back to you, and we do have until Monday the 30th of September. So, you know, if we've got time for questions now, and then if you've got anything else you need to follow up with me, do get in touch, and I can make sure we can see how well you can get your project fitted to this, and that would be great. Anything else you wanted me to cover in that part, Kate? Or
no, that's perfect. Thanks, Hilary. So yeah, so kind of any questions, I'm very, very happy to take them, or any sort of clarity on anything that we've both said today. Please feel free to put it in the chat or put your hand up, and I will stop sharing the screen. Okay.
Kate, I've got one question. Imagining I'm a voluntary sector organisation working in 2 boroughs, and I want to apply for 2 different events, one in each borough. Do I fill in 2 application forms?
I think fill in one with and saying which boroughs that you can reach in, or what those areas. So, you know, people don't live in particular areas on with a particular borough line. So if you're an organisation that kind of spans a couple of boroughs, I think just detail that in the application form. If it's just about kind of who your reach is, if you're an organisation potentially that has you know, a particular event happening in that borough and a particular event happening in that borough, do talk to us first. And they're completely different communities that you can reach in 2 of those things. That might be 2, but I would say that we would generally just fund an organisation once. So if you wanted to sort of see which one that might become, you know, a more of a target for us, then maybe do 2. But on the understanding that we will, because it's such a popular fund, we will just generally fund an organisation once. So yeah, but do talk to us if you've got any if you want to clarify any of that. Very, very happy to Hilary and I to have a chat with you.
Okay, great. I've got 2 people with their hands up, and then I've got 3 questions in the chat. Shall we go with Jill first, and then Nasreen?
Thanks very much. A couple of questions. You mentioned that the fund is to help the NHS South West London to speak and listen to people. Are there any specific is there any specific information that you want us to speak to our members about? I know when I was reading about the fund, you'd like some sort of help with them using the NHS app, and that would certainly be appropriate for our clientele, who probably average age is about 70, 75. But is there anything else you're looking for that we could incorporate for you?
So during winter, we tend to sort of try and provide information, advice around other kind of options, because A&Es and our front door services become very, very busy at that time. So that's kind of where it sort of arrived from. So the idea is that there'll be 3 or 4, well, I think it's 4 this year, 4 campaigns, NHS app being one of them, vaccinations, pharmacies, that will help to have those conversations. So hearing about people's experiences of the NHS app, or why they might not be using their pharmacies, is one thing. But we all know when you speak to local people, like, that's not, you know, you can't just speak. People want to tell you about what they want to tell you about their health and care. So this year we're really going to give you maybe some conversation prompts, some sort of questions to ask. But then obviously if people want to talk to you about, you know, cost of living came out loads last year around kind of, you know, yes, wanting to be healthy, but that kind of expense around it. So we want to hear that too. So, you know, and primary care, lots of people talk to us about our GPs. There wasn't a campaign around GPs, but that just was something that really came out. Our communities wanted to talk to us about. So we will, if it's helpful, our idea is to sort of give maybe some like kinds of questions, conversation starters in the pack around kind of the materials that you'll be promoting, but equally a space for you to sort of feedback anything else that you hear and who you're hearing it from as well. It's one thing we're really keen to sort of marry up. So we're funding you because of your reach and these particular communities that you can engage with. What are they saying? So, you know, is that one person, or is that, like, you know, your whole group of 10 where you run a little kind of focus session at the end of your activity, are saying something very powerful, very strong, and really trying to feed that back so that we can kind of collate that, and that can feed into our operational plans. Like, it's not going nowhere. The idea is that we feed it back to programme teams, and if there are things that we can change or plan for next year, that feeds into that. And that's been, you know, this is the third time, and that really is getting into a bit of a rhythm now. And we also will feed back to all of our funded organisations as well. We want to bring everyone together at the end of the programme and just kind of hear that as well. So there'll be other ways to sort of feed back. But yeah, but we all know when you have a conversation with people, people tell you what they're feeling, what they're experiencing right now. So that's totally fine as well.
That's great. So just to clarify, where I'm thinking of, because it's always hard to get, you know, people in a room together. I think we all know that. So I could apply for this across a number of activities, possibly with local partners. Like at the moment, I'm meeting with our local church, who's got, you know, mostly an elderly congregation, and also I could combine quantitative and qualitative research. So because we do an annual survey, and I'm thinking we could add, you know, we could change that around to get some quantitative data as well. So that sort of thing would all be okay within the fund.
Absolutely, yeah. If there's a way to sort of share those messages and then hear back from communities, and if you've got some sort of survey that meets the deadline, you know, the timelines for getting that, being able to feed that back to us, absolutely, we'd love to hear from you, Jill. Yeah.
Okay, thanks very much.
You're on mute, Zara.
Of course I am. And I just wanted to add, as you mentioned, there is going to be an information pack, and there is going to be also materials that you can utilize to kind of initiate these conversations around using pharmacies, vaccinations during the winter, and other topics as well. And are we going to have an induction, Kate? Too, yeah, an online induction, so you can attend and hear a bit more about what the NHS, what are these messages, and how to maybe initiate these conversations. Right, I've got one question that is related to what you were discussing, and then I'll go to Nasreen. The question is, what will be done with the information that is fed back from residents? Who will be seeing it?
So as I mentioned to on the back of the last question, it really feeds into sort of operational plans. So we have urgent and emergency care boards and work streams in each of our boroughs that really kind of step up during this time. And we have a lot of pressures on our NHS services over the winter sort of period. So it's just about supporting our communities to have up-to-date, accurate information about where they can find services and support during this time, and kind of hearing what local people want to say to us. So, you know, we'll feed it into our kind of delivery work streams that we have, and also to sort of improve the grant programme, this one and any future ones as well, kind of how it works and what we can improve on as well. So it's feeding back to people make decisions about kind of how we might, you know, support our communities during difficult periods of time, and especially this one specifically around winter pressures. Hilary.
Sorry, Nazarene, we will come to you. Just to follow up on that, though, in terms of the report that was produced and we were looking at last week with previously funded groups, is that available on the website yet, or?
It will be, yeah. It's just making it accessible, our document accessible for the website. But yeah, we can definitely share our learnings and feedback. So we collate it across the 6 boroughs into sort of a report, so sort of like a slide deck. You know, the numbers reached last year through our community groups. You know, we reached over 7,000 people through the fund. So, you know, looking at that on that aggregated scale of all of the insight across the 6 boroughs, and then also sort of breaking that down into different boroughs. So there are meetings that happen in each of our 6 boroughs. They're really keen to hear about the fund, what insights being collected. So there's a number of different places that will go, and we'll definitely kind of we can let you know what's happened with last year's, but we can talk to you about what we'll do with this year's for those that are successful in this fund. So
I think that report was very good at, you know, drawing together the different aspects that were being raised in the community, and from you as an organisation's point of view, being part of that, you've then got some evidence to build on. You've got some ideas of some of the key health related themes in the local area. So that can be useful. And I know other organisations have then said, as a result of us being part of the Winter Engagement Fund, we would now like to develop this programme and this project, you know, so it can give you some really interesting insights into your local area and the local health needs of your community, and give you some of that evidence around, well, actually, we did this collection we did these discussions, we collected this conversation, and we would like to be part of the solution to it by running a different programme and looking for different funding. Sorry.
Thank you. Thank you. Nasreen, sorry for the waiting.
Thank you. No, that's no problem. It's just a quick question about the funding period. So is it for sort of any events held in November, December and January? Is that the period that it's funding?
Yes, so yeah, activities till the end of January. So in the application process, it asks you to outline sort of any confirmed dates or times. We'd want those before you're actually funded, but we're saying not to do it at the beginning of November, so just on our timescale. So we're saying from the 18th of November till the end of January.
Perfect, that's fine. And just another quick question, just about the evaluation. Just wondered again, obviously we might have our own evaluation, but you know, it's similar to what was asked before. Is there anything sort of specific, or do you have any outline of an evaluation that you might wish us to use based on information that might be useful to gather?
Yes, so we're just developing it based on last year's, but we will give you so the evaluation is sort of through an online link, but the idea is in the information pack when you're actually doing the delivery that will sort of, it will articulate what those things are that are in the evaluation form, and we'll be able to sort of give you so you'll be able to see those questions before you get going, but they are questions about you know, what's your experiences of using local pharmacies, you know, they're quite broad questions around those sorts of themes, but it's just about, I suppose, giving people the option to sort of feedback anything and then us capturing that. So it's because it's a £500 grant, it's supposed to be really simple and not too onerous, so they're quite open, loose questions, but as much information that you can kind of gather, and whether your other evaluation kind of would probably most likely be able to sort of, you know, be lifted and shifted for this if you wanted to sort of keep things consistent to what you're already doing in your organisation.
Okay,
that makes sense.
Yeah, no, absolutely. Yeah, that's really helpful. Thank you.
Thank you, Kate. I'm really aware of the time, and there is one last question from Alicia in the chat. She'd like to ask a question in relation to NHS support. I don't know if Alicia, you want to ask it yourself or no. So there you go.
Hello. Hi. Sorry,
Hiya.
I'm actually up a lot of my experience, so you might not be able to hear me that well. My question is in relation to the NHS support that would be able to come on board. My organisation is called My Child Speech Day. We target parents that have speech delay, so children aged between 2 and 11. I think it's really useful to talk about kind of healthcare services provided during time for Mike. He doesn't take medication, he just refuses to take it. So finding out other options available during that time would be really useful. But I also want to know if the NHS support that we would be able to get would also include people like occupational therapists or speech and language therapists as well.
Do you mean, sorry, Alicia, do you mean sort of being part of your activity and event, so coming along? Yeah. So there's a question in the application form that says, would you like, you know, would you like a clinician to sort of come along? We run a lot of events, so we can't guarantee it, but you can outline in that what you were thinking might be helpful for sort of, you know, the communities that you work with and the people you work with, and then we can look at that and have a conversation. You know, if you're successful in the fund, about what that might look like. I wouldn't say we'll be able to get specific professions though. You know, our clinicians that usually go out and about are usually sort of part of our vaccination team, our roving team, so there might not be OTs and things like that, but you can definitely kind of outline what you were thinking, and then we can work with you to see if it's possible.
Okay, all right then, that would be great. Thank you.
No problem.
Okay, thank you very much. I'm afraid we've come to the end of the session. We said half an hour, didn't we? Unless there are any pressing questions, you can always obviously email hilary@training@cvalive.org.uk. But thank you very much for attending, and good luck with your application. I hope you will see loads of